we have recorded 21 new cases, 15 of them linked and 6 still under investigation. 14 of the new cases were in quarantine during their entire infectious period. We are aware that 6 were infectious in the community and the movements of 1 are still under investigation. Sadly, I can report 11 people are now hospitalised with COVID-19 and 1 person remains in intensive care in a critical condition. And again, we extend our love and thoughts to the family of that person and our thanks once again to the wonderful staff in the intensive care unit at Canberra Hospital who are providing such compassionate care. Yesterday we had 3,500 tests. So a solid number, but not as high as we have seen. We do anticipate that increasing as there are thousands of people coming towards the end of their quarantine period. Now, yesterday the government finalised some minor changes to the public health directions that will be effective from midnight tonight and operate until at least Thursday the 2nd of September and possibly longer. Under these changes, small retail businesses will be able to have a maximum of 2 people enter their premises to operate a local contactless delivery service or a click and collect service. To counterbalance this, some of the large essential businesses that have been open to the public over the past 2 weeks will be required to move to a similar contactless click and collect or delivery service. This includes hardware stores, pet supply stores and office supply stores. These stores will of course remain open for Canberrans to access the essential items they need, but that access will be via contactless means, either order and delivery or order and contactless collection. There are some further amendments to the public health directions that impact real estate, cleaning services and waste management services. Further detailed information on these changes is available on the COVID-19 website. So I need to repeat that we remain in lockdown, and the reason for the lockdown is to restrict the interaction between people as much as possible to reduce the spread of the virus. So these amendments to the public health directions allow a small amount of additional activity at a small business level, but counterbalance that with addressing what has been a major issue of the most checked in places in Canberra in the last 2 weeks, being some of those large format hardware stores in particular. Turning now to construction. The government has been engaging with the industry over the past 2 weeks. The feedback we have received from the sector is that they are committed to enacting the strictest COVID-safe arrangements that would enable a staged reopening of construction. So subject to the public health situation not deteriorating over the next week, the government is targeting a gradual recommencement of construction from Friday the 3rd of September. This gradual recommencement would start with civil construction, new roads and suburban infrastructure, for example. It would also include the manufacturing, fabrication, testing and equipment supply that will enable construction projects to recommence. Large-scale construction projects on large site footprints will also be involved in this work. So the government is providing a strict set of COVID-19 safety requirements to industry stakeholders today for finalisation. This will include physical distancing and density limits of 1 person per 4 square metres on construction sites. Under a gradual recommencement of construction, these COVID-safe requirements will be strictly enforced by WorkSafe and ACT Police. And before the final go-ahead is given to gradually recommence construction on Friday the 3rd of September, we will undertake a final safety check mid-next week with advice from the Chief Health Officer. Now, as I outlined yesterday, the decisions that we make about future public health restrictions need to be careful, and they need to be gradual, small steps forward. In the current climate, before we reach 80% effective community vaccination, we need to be very cautious. The future beyond the 2nd of September will be considered mid-next week and will be based on the public health information at that time. Turning now to vaccinations. In good news, the ACT has now passed 60% of our population aged 12 and above with at least one dose of a COVID vaccine. We continue to see strong vaccine take-up. I'm advised that 90% of the Territory's 30 to 39-year-olds have either received a first dose of a vaccine or are booked for a first dose of the vaccine. That is very encouraging for the Territory to go well beyond 80% community vaccination as more vaccine supply becomes available in the coming months. That is essential to give our community protection from our surrounding region, from the decisions of other governments beyond the control of the ACT, and to protect individuals, particularly vulnerable individuals who may not be able to get vaccinated. I'm also pleased to see that more and more people are taking the opportunity to get vaccinated now through a GP or pharmacist using the AstraZeneca vaccine. So in summary, 21 new cases overnight, 15 linked, 6 still under investigation. Sadly, now 11 people in hospital with COVID and 1 person remaining in intensive care in a critical condition. I'll now invite Dr. Coleman to provide some further detail on the new cases and the epidemiology of our outbreak. Minister Stephen Smith will provide a further update and then we'll take questions. Thank you.